Hey everyone, as you folks see, we're wearing our masks. This is Tea and Talk with Rec, but we have no tea.
No tea, what?
Except for the tea that you're going to hear from Tim Rahilly here in a little bit. But this is just a quick disclaimer to let you know that to wear your masks, go onto the Mount Royal website to learn more about the different safety measures on campus.
And there is a reason why we don't have tea. I think it's because it's pretty difficult to drink tea while wearing masks and talking. But hopefully, But hopefully in the future, if the mask mandate is lifted up, then we can actually have our tea with SAMRU Rex Tea and Talk. Yeah. So thank you for understanding and cooperating with us, and we hope you enjoy the show.
See ya.
Hello everyone, and welcome to the first SAMRU Tea and Talk with Rec.
Wow, awesome.
My name is Joseph Nguyen, and I am your Vice President of Student Affairs of SAMRU's Rec. And why don't you introduce yourself, kind sir?
Hello, I'm Spirit River Stridewolf, and I'm the SAMRU President.
Yeah, SAMRU President of?
The Representation Executive Council. It's such a long title.
Yeah, what does that mean?
Well, it means that we represent students to the institutions, such as Tim Rahilly here, as well as to all levels of government, the public, and the media.
Wait, Tim Rahilly's here. What?
What?
So Tim Rahilly, who's Tim Rahilly?
Well, we stole this from the website, I think.
Okay.
In May 2019, Tim Rahilly became MRU's 10th president and first vice chancellor, serving a 5-year term. An established leader in higher education and student affairs, Rahilly was previously vice provost, students, and international at Simon Fraser University, a position he had held since 2010. Prior to this, he had academic and administrative roles in the university sector starting in 1998. So you've been in the game for a while, haven't you?
Yeah. Dare I ask what year you were born? Was it before or after 1998?
Awesome. No, you can't. Just
So to start, just to break the ice, we're going to start off with a game. And this game is called Two Truths and One Lie. And if you folks haven't heard of it, basically, we will state two truths about ourselves and a lie in whatever order we want. And the other participants will have to guess the lie. Yeah. So I can start us off.
Okay.
I have them written down. So I was vegetarian for 1 year. I have never had alcohol before. And my front tooth is fake. Guess the lie. Dun, dun,
oh, I feel like I know it, though. We spent too much time together. I'll let you pick one first.
Okay, I'm going to go with alcohol.
Alcohol, okay.
That's a lie. Vegetarian.
Tim knows me best.
What?
I have had alcohol before.
Right.
Yeah.
Oh, really?
I've never been intoxicated or drunk, but when they're like, oh, take a sip, and I take a sip, I'm like, ew, that's bitter. I don't like that.
You're a good boy then.
You're a good boy. Can you process alcohol?
Probably not. Yeah.
Okay.
My dad has the
alcohol dehydrogenase. Yeah.
So
the enzyme.
Yep.
Yeah, nice.
That's all.
Cool. Should I go?
Yeah.
Okay. So I've had 5 surgeries. I've been in 6 countries, and I was the director for a fashion show.
That's an odd one.
Yeah.
Sorry, what was the first one again?
I've been in 5 surgeries.
Okay.
I've been in 6 countries, and I was the director for a fashion show.
Okay.
Wow.
What do you think, Joseph?
The fashion show just threw me off. Like, that's so odd.
I think he has done that. I have vague memories of hearing about this.
Okay.
So yeah, I'm gonna go with the countries.
Okay, me too. Yeah, I was going for the countries.
Okay, I've been to 5 countries, not 6. So you folks got that
Read you
one.
like a book.
All right, Tim.
Okay, so I've written down a couple things. So let's see. I've got the mundane to the ridiculous. Let's see. I once lived in an Inuit village for a month.
Oh.
I once nearly killed the former Prime Minister, Pierre Elliott Trudeau.
Oh, wow.
And I am one of 5 kids.
I feel like that went from like 0 to 10 really fast.
Yeah. I have another one too. No, so you'll know that that's actually true. Because never mind.
Fun fact.
Fun fact.
I've never eaten at Dairy Queen.
What?
Oh.
Really? Okay, well, we know what we're doing after this. Yeah. I'm going to say the almost killing Pierre Trudeau is like too wild.
Too far-fetched?
Yeah.
Really? No, come on.
I'm going to say that one.
This is Tim. I'm going to go for the third one, the siblings one.
You're correct. I am only one of two. Yeah. But yeah. When I was in grad school, I did my graduate degrees at McGill University, and the former prime minister used to walk up and down Peel Street to his law practice, and I had this really very badly maintained Ford Escort, 1983 powder blue Ford Escort car, and my brakes weren't very good. And one day in November, I came out of the parking structure, and he was walking, and I had to like stand on my brakes, and my car really didn't stop. And I came to a coasting stop as his eyes were as big as frying pans. So I could have gone down in the history books of the guy who bumped off Pierre Elliott Trudeau, which in Western Canada might make me super popular.
Oh my gosh. That's funny.
That's true.
Yeah.
Wow. Okay.
Awesome. Okay. Well, that was a good icebreaker. Our first.
The ice is broken.
Yeah, I think so. Okay, so we'll just get right into some of the questions that we had for this first iteration of Tea and Talk with
Am I the tea and tea of talk?
Yes, we're getting all the tea. Actually, I think we should have had tea. We'll have to bring tea next time. I think we're trying to get everything organized, and now it just feels like we're just trying to get gossip from you now.
I'm going to lower my mask to take a sip of my non-tea.
He's showing us up right now.
Imaginary.
Yeah. Okay, so cool. The one thing that I think students really are talking a lot about is the new safety measures with the institution. Just a reminder for the viewers watching that there's information on your screen here about where you can find more information on MRU's COVID safety measures, which are really good to know so that you can stay safe here on campus. So yeah, we had the whole summer talking about COVID and trying to figure out how to make sure that we have an in-person experience for students. What was it like going through the process of developing an in-person course delivery system?
Well, I mean, I guess the first thing I would say about that, Spirit River, is that I get to be the president of this fine organization, but the hard work, and I know it sounds like, motherhood and apple pie, but the reality is the hard work is really done by so many others. And in terms of in-person learning, obviously the faculty members play the vital role in terms of that. I think that what was challenging, or what is challenging, is that we're always dealing with a calendar that is really far ahead, right? Mm-hmm. So, we were talking about September back in February, and the world in February wasn't necessarily looking fantastic. Mm-hmm. That was before a lot of vaccines were rolled out. There was a lot of conjecture in terms of what might happen. And so we're trying to always use the best information that we have in order to inform, and trying to be realistic, neither pessimistic nor overly optimistic if you can't deliver on it. So we came out in March and said that we were going to aim for a majority of in-person delivery, and then we had to go about the task of moving that. Mm-hmm. We heard an awful lot from people about that. During COVID, it seems like everyone's become an expert in everything. Everyone's an amateur epidemiologist. Everyone knows better. A lot of medical stuff has become very politicized. And so I think that for me, one of the challenges was just trying to lead pragmatically, listening to people, hearing where they are. Because one of the challenges, I don't think you can really have a dialogue with people until you acknowledge what they're thinking and what they believe, and making sure that you tell them you hear what they said. Now, sometimes people think that means you'll automatically, if you hear what they say, means that you will do what they say. And that's just not possible. There's such a diversity of opinion on our campus. Mm-hmm. So I think for me, it's been I think for all of us, it's been tough.
Yeah.
Lots of lessons going through. I've tried to, where possible, I'm human, in case you heard anything to the contrary. But
what?
Yeah, I know.
Really getting the tea here today.
Yeah, spilling the tea.
Yeah.
But I mean, I think that it's really about trying to do this with some humility and compassion.
Yeah.
And also, I'll be honest with you, there's some people who have some pretty strong views.
Yeah.
My sense at MRU is that, we're not hearing from the majority. We're hearing from, some polarized positions within the campus community. Yeah. So, but really appreciative of the work that SAMRU has done on this, and in particular, I would say SAMRU has been pretty level-headed throughout the whole process, right? Just trying to get answers and to advocate, not necessarily agitate.
Yeah. Well, I think it's really important for us at the Student Association that we have a good relationship with MRU, and that we ultimately, I think, what I really feel and what I've been telling students since this new semester has started is that, we're here for students. And I really do feel like I get that impression from the administration.
Thanks.
So relating to that, time to toot our horn a little bit here. How important do you think the Students Association is in your decision-making process, such as the Safe Return to Campus?
Well, I mean, we purport to be a student-centered organization. And so accordingly, I think that the Student Association I recognize as a key voice for students. And so your opinions, your experiences, insights that you share with us are really important. I personally, and I think you get this, I don't think that necessarily means that any association, student or otherwise, kind of rules the day. Yeah. You're there to put forward the perspective. I think the senior administration is there to try to take a balanced view. And often there's a lot of stuff going on around us. I think we have to do an environmental scan. We're dealing with all kinds of other fine people, health authorities and ministries, and trying to work collaboratively with them. So, I think it's an important voice that's in the mix. At the end of the day, I think that people are thinking, we're there for students, but if you acknowledge that, we come up with perhaps different approaches. Okay, we're here for students, therefore we need to be ultra safe so we will never set foot on campus again. Yeah. We're there for students, and the student experience involves some face-to-face learning, so therefore we need to make sure we have some in-person. So that's where the disagreements start. Yeah. Anyway, I guess we're living in a time where, and this might sound a bit trite, but sometimes there's a message that all views are equal. Yeah. And I don't think that, and this isn't in relation to power and students, this is in view of things like COVID and vaccinations and this kind of stuff, right? Mm-hmm. So I think the student voice is super important, and it's part of an important factors for decision making.
Yeah. So you mentioned vaccinations. So just speaking of vaccinations, how did vaccine hesitancy affect the process to going back in person?
Well, it's interesting. I mean, Joseph, I would say that the first influence of vaccine hesitancy, I think, is in terms of how it affected the province. I think vaccine hesitancy at MRU, we have yet to fully find out about the extent of it as we've implemented some of these measures. But the reality is that, the province has implemented and discontinued and re-implemented various measures throughout the pandemic. And it appears to me that issues around vaccine hesitancy have played an important part in the decision-making in the province. So you saw 9 schools coming out with a shared press release about how we're going. I mean, I'm really proud that the schools took that position, but that's obviously in the absence of any mandate from the province around that. So clearly vaccine hesitancy is a real thing. Okay. In terms of what it means at Mount Royal, we've taken a position and, look forward to continuing dialogue with the Student Society about that. But we've taken a position that's, we believe, science-informed, that is about not only individuals' health, but more importantly, around the health of our community. Yeah. Yeah. And so at the end of the day, for us, that has to rule the day. And so often in the post-secondary sector, policies and procedures are built around an individual. And COVID has been a time when we really need to rethink that and think not only about individual rights, which are important, but what is the impact of the individual on the collective?
Yeah.
And that's the challenge. And there are certainly if there were easy answers, you wouldn't be asking the question.
For sure.
So it's tough. I think it's really important for people to know that for people with medical counterindications, religious grounds, we will always be making accommodations. For the average person who has vaccine hesitancy, that's a different dialogue, I think, right? And people have hesitancy for different reasons.
Yeah, for sure, yeah. Do you know anyone who has been hesitant to vaccinations?
I guess my take on this is, try to be compassionate and to understand where people are. At the same time, help them understand what the advantages are for them and for the population around it. I think based on what we're saying is, you have choice, you have agency. And as much as we want to help and do everything we can to make sure people are welcomed at MRU, they also have some choice.
Yeah, for sure, yeah.
I wonder if I can, I think what you said is really interesting because I think it really shows the nuance of the situation, how it's always an individual, in their story around the vaccine or anything like that. And I think, that was such a big thing for us because, we're looking at around 13 to 15,000 students and all of those individual stories and why, so many of them might not have gotten vaccinated. I'm actually really happy with the vaccination numbers that we're seeing right now on my MRU. I kind of thought that was going to be the case, but it's nice to see those numbers. But I know for us over at the Student Association, what's been really important is to ensure that, we get students on campus, and vaccinations are one of the main ways of ensuring, that we could actually be on campus, because I know that's something that students have really talked about.
Yeah, I appreciate the students' position or the SAMRU's position on this. I think it's really interesting because, we have had feedback anecdotally from students who attended our vaccine clinics.
Oh, nice.
The whole vaccine tracker on my MRU, I think it's almost like, I started my life as a psychologist. Well, I started as a baby. But later I was a psychologist. A psychologist baby. And there was a lot of work done not too long ago, or maybe it's getting a bit older, about social norms. And so, there's all these things for university-age students around things like drinking or sex and all this kind of stuff, right? And so the research was showing that people were overestimating. They were thinking all their friends are living, they're drinking and they're having they're doing all this stuff. And then when you ask the people, how much you drink or how sexually active are you or what, all this kind of, it turns out that it's a little bit more mundane. And people aren't, and then I think there are people who are in pockets around vaccines and anti-vaccines where everyone around them is thinking similarly. I think that vaccine tracker, for some people who have chosen at this point not to have they're looking and saying, oh, here's 15,000 people, and there's about 500 people who haven't had the vaccine or who are not declaring. And they're like, wow, that's a huge proportion of the people around me because they're not talking about it. It's an uncomfortable topic. And so I think that, kind of bringing this into the light and having people recognize that, this is a reasonable thing to do. The vast majority of people at MRU have done it. And maybe I should give this another thought.
Yeah, definitely. I think that's such a good point. And kind of another thing that students have been talking to us a lot about is we're back on campus. We have the vaccine clinic that came by, and
we're going to have another one.
And we're going to have another one. And I heard it was a really big success, by the way. A lot of people showed up to it, which is amazing. I really do think students are really, wanting to be vaccinated. They want to be on campus. But I think there's also still that anxiety as we're coming onto campus. We had different surveys with our federal student lobby group, the Canadian Alliance of Student Associations, and we had information and polling from students from across Canada that said, online was not ideal for them. They really want to be back in person. They missed that in-person experience. So they're excited to come back to campus, and we've seen that with our rec barbecue today.
Which was a huge hit.
Yeah, huge hit, yeah. But they're also worried about the uncertainty of what the future holds. Yeah. We're getting emails from students and some of the volunteers from our advisory committee and other folks, and they ask things like, will we be online by November? There's a lot of, I think, pessimism that's kind of coming into the community right now. Are the safety measures enough? And just general uncertainty. So I wonder, what would you tell those students who are worried about all of the uncertainty in the air right now?
Well, I guess I could try to address that in a couple different ways. You know, obviously, like everyone else, I don't know what the future holds. I want to remain...
What?
Yeah, I know. Get my psychic... that wasn't in my two truths and a lie, my psychic abilities. I have a tiny bit. I delude myself that I have a tiny psychic ability, but sadly not on restrictions in COVID and or lotto numbers. But I think that, you know, first of all, I would say that feeling anxious is completely legitimate. Mm-hmm. We've been through an awful lot. Yeah. You know, when people first went home, that also created some anxiety and some other issues, some people in terms of mood and other things, right? Yeah. But, you know, I try to fancy myself self-aware enough, but, you know, the world over the last year, you know, I can remember, you know, lining up to go into grocery stores and social distancing early on. And, you know, I remember being at the grocery store and someone kind of like reaching past me to get something off the shelf. And I'm like, whoa, you know, you're in my bubble, you know, back off, you know, because I had been, you know, 8 months of social distancing. And something that would have been quite routine previously was just a little uncomfortable. So I think we're living through a period where we're readjusting. And, you know, it's like this morning I came on campus and or I was driving to campus and a couple buses let off folks at the main bus stop and I couldn't proceed. And, you know, pre-COVID, I would have been like, you know, why can't I drive? And instead I'm sitting in my car beaming, looking at all of these people coming on campus. And I'm just so excited to see them. I happily sit there and do that. So I guess, number one, I would say, look, it's a time of adjustment. Number two is, you know, I think I would really recommend people try to channel that by wearing a mask, you know, being vigilant about your health. If you don't feel well, don't come to campus. And for goodness sake, get vaccinated. And, you know, if you're doing those things and you're following the health measures, then I think then you're doing what you can. And that's what we want to do. We think these measures work, that they're effective. And then really we're just saying to people, you know, you're going to have to learn to live with this, as we all are. At some point, whether it's now or later, we're going to make our return to campus. We're going to have to go through this process one way or the other. You know, I'm not completely tone deaf to this. I mean, I track the cases, I track hospitalizations. I know we're not in great shape, but we do know that that vaccinated people are not necessarily among those who are having to be hospitalized or having to be in ICUs or having these kinds of really terrible outcomes, right? That's certainly our hope. There can always be exceptions, but by and large, right? So anxiety, okay, I get it, but let's try to find our way forward. And then in terms of what does the future hold, I don't know. I know that we've done amazing things so far. I don't imagine at this point personally that we would find ourselves going holus bolus completely online. When that happened before, we didn't understand the virus, we didn't have vaccines, we didn't have rapid testing. So I'm very hopeful that we'll be able to continue along in some way. Maybe worst case scenarios, not sure I want to go there. But, you know, you may recall last year they did a bit of a circuit breaker in the schools or what have you. So my hope is if we ever do have to go off campus again for this or anything else, that it's for a circuit breaker and we're able to come back on campus.
Yeah.
So what's the circuit breaker? Sorry.
So I think a lot of people in some provinces, and they did it in the K-12 system here, where they said, look, cases are spreading. We need to put an end to that. Let's take 2 weeks or 3 weeks off campus so that we're not doing any transmission. Get the cases, get the hospital beds emptied out, so that we can reduce the. But again, I've probably gone way into the weeds. Emails will start flooding, but I'm hoping that we will be able to stay healthy, and that for the most part we'll be able to move forward.
Mm-hmm. Yeah. Awesome. Well, yeah, and I really agree with you, because I know in the thick of the pandemic during my first term, I was telling you, I was like, right now people are in this heightened alert system. I remember I was telling you, you're walking down the street and you see someone walking towards you, and your alert system comes up and you're like, am I going to go into oncoming traffic or walk by this person because I'm freaked out about COVID?
So I think you're right. Spirit. And, I think with respect to the health measures, personally, I don't know if it means anything to anyone other than me, but I tell myself, anything that we're doing on campus it's things I would be willing to do. I'm willing to go into these situations. I have agency. I have my own well-being to look after. I'm willing to wear my mask. I'm willing to be in the presence of people. I'm not hiding out. I'm following the health restrictions, and I hope everyone else does too.
Yeah, definitely. Thank you so much.
Yeah, thank you. Yeah, I think that's all the questions we had.
Yeah. Well, thank you both. I think I'll say this, and you can maybe infer what I'm getting at. But leadership in these times is not easy. Mm-hmm. Really appreciate all the work that's been done by the previous administration, and of course, for those of you like yourself, Joseph, entering into office this year, I hope it goes really well. It's an interesting time to be a leader, and I'm sure you'll learn an awful lot from it. And I really enjoy working with great young people like yourself. I think it makes my job, it's one of the highlights of my job.
Awesome. Thank you so much. Well, thank you so much for joining us on our first iteration of Tea and Talk with Rec. I think this is a message that students needed to hear.
For sure.
Great.
Yeah, thank you everyone that attended, and on to the news segment.
Yeah, and stay safe, wear your mask, get vaccinated, and if you're sick, for God's sake, don't come to campus.
Awesome. Thanks.
Welcome to the news segment of the Tea and Talk with Rec. Yeah. So we've already introduced ourselves, and Tim was a great guest. He
was really great. I really enjoyed talking to him. I get to meet with Tim around every month or so, and sit down with him and talk to him a little bit about what SAMRU's been up to. But I think that was such a great way to show students the kind of questions we ask them, how we advocate for students. And I really liked what he had to say about, the importance of the Student Association and in terms of how he makes decisions.
Yeah, so this news segment is mainly for communication, right? For SAMRU Rec, us, and Spirit and Rachel and Yasmin to communicate to the student body of what we're doing, right? Because sometimes we get questions like, oh, what is SAMRU Rec doing for us? Where's our student reps? What are you folks doing?
Yeah, I think it's super important too that, that's another reason why Joseph and I were thinking about wanting to do this, right? Because we want to try to connect with students as much as we can to kind of tell them what we've been up to. We don't want to bore you with all of the things that we've been up to, because we've been up to, sometimes we're working up to 8 to 12 hours in a day, working hard on projects and, advocating for students. But we thought we picked out a few. I think.
We kind of picked the top 5, I would say.
Yeah, I think so.
So speaking of the top 5, you won an election, I heard.
Yeah.
Tell us about that.
Yeah, cool. So, very early on in the summer, I was elected as the Director of Policy for the Canadian Alliance of Student Associations, which is one of 6 seats on the Board of Directors.
Ooh, so Canadian Alliance what association?
Yeah, so it's the Canadian Alliance of Student Associations. Basically, it is the student lobby group for Canada, essentially. It's a federal student lobby group. And a lot of people don't really know what it is. You might know of SAMRU, right, the Student Association, but you don't realize that the Student Association is a member of different lobby groups where we essentially work with other student leaders across the province. Or in this case, across the country, from coast to coast to coast. So it's literally a Canadian alliance of student associations.
So CASA is the acronym?
Yeah, CASA.
So it's basically like a bunch of student associations come together to create this mega student association.
Yeah, definitely.
Yeah, that's awesome.
Yeah, it's really cool.
Another point of advocacy was, so we've seen the numbers, and Indigenous registration rates have been dropping.
Yeah.
So what's been going on there? What's the reason?
Yeah, it's, as the first Indigenous SAMRU president, Indigenous issues, as a lot of students know, is something that really matters a lot to me. And I was really concerned to see over the through the 2020-2021 term, we've seen a significant lowering of the registration rates of Indigenous students. And it's been a bit of a concern for us.
Yeah. So what steps are we taking? What are the next steps to address that issue?
Yeah, well, I think it really depends, right? So right now, we have some ideas of why it happened. And really it depends on to see what the registration rates look like for this new term.
Yeah.
But I really do think, it being COVID we're still in COVID, obviously, we're wearing masks. And I think that it definitely puts more barriers for especially Indigenous students who many come from reserves, right, where there's poor internet infrastructure. And then as well during the thick of the pandemic, where we had no vaccines or anything like that, in-person recruitment, for MRU to actually go to reservations and to go
advertise and
to actually talk to students.
Come to MRU,
that ability was not really there during during the winter or fall semester of last year. So that was definitely a concern. That's definitely a concern for us, and we're gonna watch to see what is, if that really was the case, and if we see a increase of those registrations. But
more to be updated. Yeah,
definitely.
I'm glad that you're cognizant of this issue and that you're just eyeing it closely.
Yeah. Definitely.
So the next advocacy is, we're both on the Board of Governors, but students don't really know what the Board of Governors, or what we call BOG, is. Yeah.
Well, I think that's so cool, because a lot of students think, and I think a lot of people get this idea that, as student representatives, you elect us, you help pay for our salaries and things like that. But then you don't know, you kind of think oh, they don't have real power or anything like that. But actually, one thing that was so incredible was to see that, on the MRU Board of Governors, which is the highest decision-making authority at MRU relating to business matters and operational matters, that you have 2 student representatives that sit there, and you're looking at them.
What?
So we're 2 votes out of the whole board. So that can be a challenge sometimes, because then, for example, for tuition increases, SAMRU student representatives have always voted down those tuition increases, and for a good reason. We do actually think it's detrimental to the
student body,
to the student body, but also to the organization of Mount Royal. But we do have that voting power, but a lot of it's politics.
Yeah.
2 votes, right? So it's a lot of politics, a lot of trying to talk to people and trying to mobilize students. But that's what you folks pay us to do, and so I'm very honored to be in that position.
Yeah. Speaking of the BOG, or Board of Governors, we approved something called the IMA, or the Investment Management Agreement. What does that mean, and what does that mean for students?
Yeah, well, there's so much in the investment management agreement. I won't get into it too much, but basically it's an agreement between Mount Royal University and with the government of Alberta.
Okay.
It's the agreement that really essentially allows Mount Royal to receive the funding from the government, because Mount Royal is a public undergraduate university, and we're publicly funded. So the government actually provides Mount Royal with funding through the Campus Alberta grant, and the investment management agreement is something that's really makes that happen. So if we didn't sign it, we wouldn't have funding, we wouldn't have a school.
So what's the catch? Like, do we just get free money? Like, what's the criteria?
Yeah, well, sometimes it's not always, there's always been like performance indicators, right? So like making sure, like the government wants to make sure that it's giving money to organizations and schools that are effectively using that money.
They're like actually doing something with it and growing and thriving with it.
But the one thing that's new with the new government of Alberta is that they're introducing something called performance-based funding. And so basically what it is a bunch of different metrics that the institution has to achieve in order to receive a certain percentage of the funding. You meet that metric perfectly, you get 100% of that allocated funding percentage.
I see.
So the one this year, there's only one performance metric, and they decided to only do one performance metric, probably because of COVID.
Yeah.
Right. Like a lot of different trying to increase student, enrollment or international. A lot of that can be really challenging in a pandemic.
Yeah.
So
what's the metric?
The metric is work integrated learning.
Oh, that's like practicums and all that, right?
Essentially. Yeah, it's like co-ops, it's like internships, things like that. And the one really good thing is that Mountain Royal is actually a leader when it comes to work integrated learning components to our education. So
we probably met that metric
it was extremely doable. So this was kind of an easier one for us, fortunately.
Yeah, so I have for the next one is about how you told the MRU BOG, or Board of Governors, the Finance Committee, you had a discussion with them on the IMA, Investment Management Agreement.
Yeah.
Can you elaborate about that?
Well, okay, so we heard from the government, we're going to have this Investment Management Agreement. It's going to be work integrated learning. And for us, what was our concern as a student association? And what was it that we were going to bring forward as a concern? For me and for my team, one position that we agreed on, that students should feel supported to feel confident in their ability to practice the skills they learned in their programs of study. So that's really, it doesn't matter how work integrated learning is put there as a program. It really, for us as students, what matters is our confidence when we go through an internship or when we go through a co-op, that we should come out of that and come out of our degrees feeling confident to be able to practice the skills that we've learned.
Yeah, that's for sure. Yeah, I've heard of stories where people go through WIL or work integrated learning and they actually feel more stressed. Like they're like, I really don't know anything. Some practicums wow, this was not in the textbook. you know what I mean?
Definitely.
Yeah. So I agree with that. That's very important to make sure that the students feel confident coming out of an internship or anything work integrated learning wise. Our last but not least advocacy point was at a cause meeting. So before we jump in, what is cause? CAUS?
Yeah. So I talked a little about CASA, right? The Canadian Alliance Student Association. The federal mega student association. And now it's CAUSE, which is the Council of Alberta University Students. So that's
so it's like the mega provincial.
Exactly, right? So I'm on that council with the Vice President External, Rachel Timmermans. She was actually elected. That's another really big highlight to point out, is that our very own SAMRU VP External, Rachel Timmermans, was elected to be the chair for CAUSE.
Yes.
And so although she is, my vice president, she's also my chair for the Council of Alberta University Students. And in that role, she is effectively representing university students across Alberta. So she's been doing incredible work talking to politicians and to leadership about serious issues like tuition increases and mobilizing students and other things. And the other thing here that we have was we were able to, a lot to do with Rachel's leadership, was we were able to come to a consensus as a council on different priorities that we were going to focus on for this term.
As CAUSE, we're going to prioritize mental health this year.
And mental health is actually one of them. Mental health, sexual violence, affordable childcare, which is really important because the federal government has it in their budget to increase more funding supports for affordable childcare.
Oh, nice.
Yeah, so that's a really huge one that CAUSE is wanting to really dive deep into this year. Financial aid, of course, is super important to cause. Yeah. And then expanding Indigenous student services in universities. And I think that's really important because that's the first, this is the first time that cause is actually taking on a priority having to deal with Indigenous students.
Yeah, that's awesome.
Yeah, so it's been amazing. So,
okay, well, folks, I think that's all. That's all we have for our spicy advocacy.
Yeah, I think the last thing I'd just say is, you know, if you want to learn more, you can go at SAMRU Rec. You could also go to the newly updated SAMRU.ca.
Yes, it's beautiful.
It's really beautiful. Yeah. And I think the last thing I'll mention too is we're still in dialogue right now as we're recording this about the MRU safety measures, the ones that we were talking about with Tim, as well as the vaccine mandate that came, that's going to be coming into effect in January. So at the time of this recording, we're talking SAMRU, we're doing our jobs. And if you want to learn more, go to @SAMRU Rec on Twitter or SAMRU.ca.
That is all the time we have, folks. Thank you so much for attending and watching all the way through. And we hope that you have a fantastic day.
Yeah, see ya.